Hello, everyone. My name is Gabrielle Loera, a quality management analyst here with CHP Quality Division Department, and I would like to welcome you to our Community Health Partners Provider Education Training, an introduction into CHP quality management and regulatory webinar. This training is set up to be self-paced, so please feel free to view this training information at your own availability. During this training, I will be discussing central topics to CHP Quality and Regulatory Division, such as MIPS, a general overview, an introduction into CHP MIPS scorecards, MIPS specialty measures, medical assistance impact on MIPS data capture, CHP provider reference guides for 2023, open delinquent encounters, and patient experience, as well as some notable references to these helpful CHP tools: CHP Visit Metrics Dashboard, Healthy Planet, NRC Patient Experience Portal, CHP Safety and Risk Trainings, our quality webpage, and Quality Corner newsletter publications. Let's begin with our first segment of this training, MIPS, an introduction into your quality metrics. So what is MIPS? MIPS is a merit-based incentive payment system, which is a quality payment program established and managed by CMS. MIPS was designed to tie payments to quality and cost-effective care, drive improvements in care processes and health outcomes, increase the use of healthcare information and reduce the cost of care. Your MIPS performance is measured across 4 areas, which is quality, promoting interoperability, improvement activities, and cost. The quality performance category assesses the quality of care you deliver based on the performance measures created by CMS. Promoting interoperability performance category promotes patient engagement and the electronic exchange of health information using a certified electronic health record technology. A defined set of promoting interoperability objectives and measures will be reported for this segment. The improvement activities performance category assesses how you improve your care processes, enhance patient engagement in care, and increase access to care. The cost performance category assesses the cost of the patient care you provide. CMS calculates cost measures based on Medicare claims to determine the cost of the care you provide to certain patients. The MIPS performance year begins January 1st and ends December 31st of each year. If you are a new provider with CHP, you can expect to receive a MIPS scorecard detailing your quality metrics percentages on your performance after 90 days of data has been collected. If you are an established provider already with CHP, you have received a monthly MIPS scorecard during 2022 and will continue to do so into 2023. CHP MIPS reporting will be submitted by March 31st for the following performance year. MIPS timeline is described in the flow chart just below. 2023 is our performance year in which data will be collected. Data collected in 2023 will then be submitted by March 31st of 2024. After submission, performance feedback will be given in that latter part of that year. In 2025, CMS will receive a MIPS payment adjustment for our 2023 MIPS reporting submission. Your MIPS quality measure performance is formulated by a percentage of patients that have met each measure. It starts with the provider's initial population of eligible patients who have been seen in the measurement year. This initial population is specific to each quality measure being calculated. Once that initial population is identified, patients are removed based on the quality measure specifications that meet exclusion criteria. This removal of excluded patients then leaves you with the remaining patient population that falls within the denominator of the measure. From there, patients who meet the conditions of the quality measure are identified in the numerator. This is what renders a quality performance percentage for each measure you are assessed in. This is a visual representation on how quality measure performance is determined. This example is centered on a specific quality measure named CMS 127, pneumococcal vaccination status for older adults. For this provider, it is determining that this patient is in the initial population for the measure. This patient is within the correct age range and has a qualifying encounter with the provider for the measurement year. This patient does not have a qualifying exclusion reason to be omitted from the measure. Therefore, the patient is now established in the denominator population for the measure. In order for the patient to be identified in the numerator population, or AKA meet the conditions of the measure, the patient had to have received a pneumococcal vaccination on or after their 60th birthday and before the end of the measurement year, or ever had an adverse reaction to the vaccine before or at the end of the measurement period documented. For this particular patient, a qualifying pneumococcal vaccine was received within 2022. This patient is now identified as compliant for the quality measure. If this provider had a denominator patient population of 189 and had 116 patients who met the qualifying measure conditions to be compliant by the end of 2022, the scorecard will reflect that this provider is having a 61.3% quality measure performance percentage for CMS 127. This is an example of a CHP scorecard. Let's identify some important indicators in reading your MIPS scorecard. Your scorecard will consist of a year-to-date graph view. Each quality measure you are being assessed on will have its own graph indicating monthly performance rates for the data that has been collected, along with a year-to-date percentage shown in yellow at the far bottom right of your screen. Towards the top view of this scorecard, you'll see a CHP average percentage shown as a blue dotted line across the graph. This is the mean score of all CHP providers based on the specialty for the selected MIPS measured during a reporting cycle. This average will reflect change over time. The solid green line on your scorecard indicates the 7th decile. This is a benchmark established by CMS that is the minimum providing scoring required to estimate a positive MIPS payment. The purple dotted line displayed on the MIPS average, which is a 2021 mean of MIPS performance data for the selected measures. This average will not change over time. For 2023, scorecards had begun to be sent out as of April and will continue quarterly the remainder of the year. For new providers with CHP, you will not receive your first MIPS scorecard report until after 90 days of data has been established and collected for you. This is an example of an alternative view of a MIPS scorecard. Compared to the previously shown scorecard, there are a few items omitted. This will be specific to certain quality measures that do not have a 7th decile or a MIPS average established. This is due to substantive changes made in the program year 2021, where the program rate for 2022 could not be determined as the benchmarks are based on program year 2020 data. Providers can expect to receive their MIPS monthly scorecard via email. Data will be pulled the second week of each month, compiled into individual and group reports, and then distributed accordingly. All data is pulled directly from Epic, and the reporting parameters are based on ECQM specifications as defined by CMS and validated by CME. For CHP, MIPS quality measures have been distinguished by provider specialty. These quality metrics will be reported on your quarterly scorecard. For oncology providers, your measures are focused on the following 6 metrics. CMS 68, documentation of current medications in a medical record. CMS 157, medical and radiation pain intensified, quantified. CMS 22, screening for high blood pressure and follow-up documented. CMS 147, influenza immunization. CMS 127, pneumococcal vaccination status for older adults. Tobacco use screening and cessation intervention is CMS 138. For our pediatric providers, your focus 6 quality metrics are CMS 146, appropriate testing for laryngitis. CMS 117, childhood immunization status. CMS 2, preventative care and screening for depression and follow-up plan. CMS 154, appropriate treatment for upper respiratory tract infection. CMS 153, chlamydia screening for women ages 16 to 24. And CMS 155, weight assessment and counseling for nutrition and physical activity. And for our family medicine providers, this specialty has a total of 8 quality metrics. CMS 122, hemoglobin A1C poor control. CMS 22, screening for high blood pressure and follow-up documented. CMS 124, cervical cancer screening. CMS 147, influenza immunization. CMS 130, colorectal cancer screening. CMS 127, pneumococcal vaccination status for older adults. CMS 125, breast cancer screening. And CMS 165, controlling high blood pressure. Internal medicine providers are also included in this specialty genre. In capturing MIPS data, we must consider all impactful roles outside of the provider involvement. Medical assistance and practice workflow is key in entering appropriate documentation that will satisfy quality metric conditions for patient compliance. Integrating a MIPS-supported workflow with your MAs will follow increased performance across all quality metrics, accurate documentation of measures within Epic, and overall improve continuity of care of your practice. Here are some steps to implement with your MA staff to promote these desired outcomes. Implementing a routine reconciliation of outside records. This would include Epic's Care Everywhere and ROI requests with external clinics where patients have received relevant and/or pertinent healthcare services. The review of health maintenance section at every patient encounter during during the evaluation to address and account for any outstanding care gaps in Epic. Schedule follow-up appointments for any screenings and/or immunizations that are identified as past due or never done. Documenting patient refusals for immunizations and/or allergies to vaccines into the patient chart, and completing a medication review during all patient visits. CHP Quality Division encourages you to share all and any MIPS-related information with your office staff. Collective support on all fronts will ensure greater success and meeting compliance for your specialty quality metrics moving forward. In relation to MIPS, the CHP Quality Division created helpful manuals known as provider reference guides. These guides will be an important tool when utilizing and navigating your way through the quality metrics in your specialty. Each year, providers and practice managers will be given their own provider reference guide specific to their specialty. These guides are updated annually with the most up-to-date MIPS quality metrics information. The guides will assist CHP practices in understanding MIPS quality measures and how to accurately report data into EPIC. When opening your provider reference guide, the first page you come to is the table of contents. This section will list all MIPS quality metrics that apply to your specialty, including measures identified and reviewed with you on your MIPS monthly scorecard. With each specialty measure included in your guide, you will be able to review the following: descriptions of eligible patient populations, provider involvement, and documentation guidelines. Towards the bottom of the table of contents, a level of service section is included with the visit type and associated CPT and EMM codes for easy reference. In your guide, specialty measures will have this view. At the top of each page, the quality measure title will be identified. Just below will be the specialty measure description. This will give you the qualifying conditions for the measure. Next portion will identify the level of provider involvement required for the measure. It will be described at the minimum level of intervention required, as well as any important notations to support the measure's qualifying conditions. Underneath is a service needed for compliance section. This information is simplified to quickly identify the type of services needed to fulfill the measure. This brings us to the largest section labeled Documentation Guidelines and Measure Best Practices. This will provide you with the measure-specific guidelines for appropriate documentation capture into EPIC. In addition, there is also a section specific to measure exclusions. Documentation is essential to accurately account for patient exclusions. MIPS 2023 benchmark top decile will also be identified in the measure, and any associated coding with the measure capture will be stated at the bottom of the page. This page presentation will be consistent throughout the provider reference guides across all specialty measures. Now I will introduce you another quality topic, open delinquent encounters. CHP Open Delinquent Encounter Report is a monthly report which evaluates both group and individual provider performance related to timeliness of documentation. Just for reference, CHP definition of a delinquent open encounter per policy 27532 is a delinquent medical record is defined as a clinical encounter without necessary elements and appropriate authentication greater than 7 days after the encounter ended. The reporting period for this report is the prior 12 months, and there are two measurements for open delinquent encounters. Encounters that are currently open, delinquent for the reporting period, and the rate of those open delinquent encounters based on the total number of encounters for the same time period. This report is sent to the Director of Practice Management for the location of each visit. This would be the general view of an open delinquent encounters report. This view shows delinquent encounters for the 12-month period. Please note that the number of open delinquent encounters are as of the date referenced on the report in the area circled in red at the top of your screen. The layout of this report features several columns of information. CHP support with the assigned primary visit departments under that individual, primary visit providers, open delinquent encounters, total encounters, and open delinquent encounter rates. The colored values indicate at a glance the following. Green indicates less than 10 open delinquent encounters, which is a CHP target threshold for all providers to be under. Yellow indicates between 10 to 20 open delinquent encounters, and red indicates a greater of 20 open delinquent encounters. For more up-to-date numbers, your practice manager are able to utilize the EPIC CHP Visit Metrics Manager dashboard to view real-time open delinquent encounters data for your practice and associated providers. In this segment, we will be introducing to you CHP patient experience. The patient experience at CHP focuses on two components, CAPS for MIPS and real-time survey. CAPS is a CMS MIPS survey that consists of 59 questions assessing 10 domains of patient experience. CMS will have this survey mailed to a small sample of CHP eligible patients to complete. This survey will be sent out once a year in the beginning of October. Real-time survey is a 10-question internal survey, which provides feedback from a larger portion of our CHP patient population. Real-time surveys are consistent and provide a more timely evaluation of patient experience. In speaking with patients about our CHP surveys and processes, please limit your communication to the following. Encourage patients to complete the survey and share their own experience about their patient care they had received, and notify patients that they may be asked to participate in the survey. Real-time survey application process can provide several benefits to our CHP practices. Patients will be asked multiple questions to touch on different domains of patient experience, which will allow providers and practices to evaluate performance on these different areas of patients' experience during their visit. CHP is able to receive immediate insight into current patient care services and allow our practices to improve those processes. Survey feedback will inspire staff behavior changes to further drive improved patient experience and care. This survey is a mixed mode delivery where patients are contacted via email, SMS text message, and IVR automated phone calls. CHP provides two survey question sets based on the type of encounter setting the patient had experienced. Patients who had an on-site encounter will receive the set of surveys questions identified on the left-hand side of your screen. Patients who had encountered over a telehealth will receive the set of survey questions seen on the right-hand side of your screen. Please go ahead and take a moment to review these questions and see the question sets for each individual setting. This is how the mixed mode delivery survey is performed. Patient experience survey timeline first begins after the patient completes a visit with one of our CHP providers. The patient will receive the first outreach attempt via text message to complete the survey. If the patient has yet to respond within 24 hours, they will receive a second attempt via email to participate. After 48 hours, the patient will receive a third outreach via IVR phone call to take part. Patients have an allotted 14 days after each outreach attempt to respond before the survey expires. This brings us to our final segment of this training. I will briefly introduce to you some of our CHP quality resources to assist your practice and providers here. This is a brief review of one of our CHP Quality Division's helpful tools, the PNA CHP Visit Metrics Manager Dashboard. This dashboard provides drill-down data on visit-based metrics such as volume of new and established patients, closed and open delinquent encounters, and no-shows. You can find this dashboard in Epic by locating the dashboard icon circled in red at the top corner of your screen. Once you have accessed this dashboard, you will see a box labeled Summary Level. You can select the desired department and provider you wish to see visit data from. Please keep in mind that only one selection for a provider and department can be selected at a time. You can also modify the calendar timeframe you wish to view data from. You have the option to choose from pre-populated selections from a year, quarter, month, week, or even for a specific day. In the Visit Metrics Manager dashboard, you will see a series of graphs. Each graph is a report from Slicer Dicer. Here is a quick sample view of the 7 graph views you will encounter in this dashboard, starting with new visits, established visits, nurse-only visits, all patient visits, open versus closed encounters, no-shows, and open encounters all time. If you are wanting to see specifications for each graph, just hover over the desired graph view you wish to see and review. It will describe data model, time frame, service area, primary provider, or department. It will also include data criteria that was excluded. On the top right-hand corner of each and every graph, you will see an Explore Detail icon seen in red here. This icon will allow you to see more information in this drill down setting. In the Explore Detail drill down setting, you'll be able to see Slicer Dicer options. This view will show you population details at a glance, any measures associated with the chosen data graph, dates, and visual options. On this slide, you will see the data graph that is especially important in viewing information about closed and open delinquent encounters for the practice or your provider. The green colored portion of this graph is displaying the number of closed encounters thus far into June of 2023. As a user, I would like to see how many open delinquent encounters I currently have indicated in purple. Furthermore, I want to know the number of visits and what encounters and patients fall within this data report. By selecting the Detail Table icon circled in red under the Visual Options section, I'll be able to access a detailed account to assist me in closing those open delinquent encounters for this month. If a user is in need to export this report to the to follow up on at a later time, you'll be able to do so and export visits to Xfile as needed. Our next helpful CHP tool is Healthy Planet. CHP Quality Division has been developing a new quality metrics dashboard. This dashboard will be accessible to CHP providers and practice managers to view real-time performance percentages for additional HEDIS quality measures alongside with MIPS specialty measures. Preliminary testing was conducted during the summer and will become live later this year following an official announcement from management. Let's take a sneak peek as to what this dashboard will look like in Epic itself. In partnership with PNA, the Healthy Planet module was developed within Epic named CHP Care Quality Dashboard. This will be the homepage view of this dashboard. Starting from the top left section, reporting workbench favorites and recent run reports are able to be easily accessed. Just below, we come to our first section of CHP Care Quality MPMs for diabetes metrics. Providers will be able to access measure information for control and testing results for hemoglobin A1C, blood pressure, and LDL. Depression screening foot exam and eye exam metric results will also be present in this section for identified diabetic patient populations. In the bottom left-hand corner of the screen, CHP Care Quality MPMs for general metrics are displayed for review. These metrics were included to support providers in identifying care gaps and drive better quality improvement in patient care for real time. This section will expand and include more measures over time to address additional care gaps. On the right-hand side of the home screen, there are several supportive views and options. Top right section will display your in-basket at a glance. The Jump To section below, a provider will be able to display or access a phone, outreach, or letters encounter. Activity options allow access to Smart Phrase Manager and My Reports. The web links section contains links to jump into listed websites such as Community Medical Center's website, various medical journals, and medical news organizations. At the bottom right section, the Up to Date is a search tool utilized to research clinical content from multiple sources, such as peer-reviewed journals. Once the CHP Care Quality Dashboard becomes live and PNA sets up individual access, providers will be able to see a new icon within their Epic called the dashboard icon, which I have identified in red at the top left-hand side of your screen. When selecting this icon, the dashboard will be searchable in the drop-down arrow, in which you will be able to add it to your favorites for easy access at a later time. Users will be able to review data by selecting a summary level. There are 3 options starting at a high level of department group, then department, and onto individual provider. Based on your summary level selected, available department groups, departments, and providers will become accessible to you. Through this dashboard, there will be a component information button icon that I have circled in red. By selecting or hovering over these buttons, various information will be displayed. Data specifications, last date the information was refreshed or processed, and my panel metrics descriptions. In the MPM's diabetic and general metrics section, you will see colored values displayed into the current quarter months with a final month-to-date column on the far right. These values are the quality metrics percentage ratings. By hovering over a colored value, a few more details will pop up. Next to the stated percentage value in parentheses, you will see the numerator and denominator patient population that make up this value. Below will depict the thresholds for each color indicated. Green indicates that your patient population compliance is being identified between 90 to 100%. Yellow is 80 to 90%, and red is 80% and below. When clicking on the value you wish to review in detail, viewers will be presented with a series of drill down options: department, provider, and patient drill down. If you're wishing to see what your patient population is being identified for the measure based on the selected value, patient drill down selection will open up a wealth of in-depth information for review. When selecting patient drill down, there will be several useful information for viewing at a glance. A scrollable patient list for the selected metric will be shown. This will allow the user to identify a multitude of specific individual patient information, including if the patient is being identified as compliant or non-compliant for the measure, as shown at the top right hand of your screen. When selecting an individual patient, a display chart of all qualifying NPMs will be in view. It will state the metric name, the metric outcome, if it was met, not met, or if that patient was excluded. It will identify the last associated value and last date of that measure value within Epic. A user will be able to see if the patient associated care team that is identified in the patient chart will then come up to view, as well as a snapshot of the health maintenance section and currently tracked care gaps identified in Epic for that patient. You are also able to access the patient's chart directly from this view by just double-clicking on the patient's name. The CHP Care Quality and Healthy Planet module dashboard has various reporting capabilities to access and tracking and providing follow-up with metric compliance and care gaps. Following an official announcement of a go-live date, PNA will support our CHP providers and staff with training opportunities for this dashboard and a quick reference guides for navigation and utilization within the Healthy Planet module within Epic. Our next available CHP quality tool is the NRC Health Patient Experience Portal. This dashboard allows users to view Net Promoter Scores for a CHP practice or a provider. A Net Promoter Score, also known as NPS, is a metric used to measure CHP's patient experience performance. A user can also view patient responses to both telehealth and medical practice question set calendar timeframes to see patient experience results, and create a saved favorite reports and filter presets for subscribing reporting. There are a multitude of reports that can be accessed into the NRC portal, but here are some highly frequented reports for this dashboard. Experience overview as seen on this slide, department and provider summaries, trends reports, feedback management, score summaries, and benchmark reports. The NRC Patient Experience Portal offers an in-depth training module that reviews the various reporting options and settings to view patient experience performance. Our CHP Quality Division highly encourages you to sign up for our next quarterly training this fall. An official date will be posted on our main webpage under the label 2023 Available Training Events as seen on this slide. This section of our webpage is continuously updated, so we ask that you frequently visit it, maybe once a month, to see if any dates or upcoming trainings become available. Additionally, CHP offers a variety of safety and risk trainings on our following topics: iris management, patient experience portal navigation, fire life safety, fire extinguisher monthly inspection. If you're interested in scheduling your staff for any of these opportunities or your practice, please ask your practice manager to connect with our Innovation Performance Improvement Specialist, Renee, at his inbox to get your practice on calendar. Many of these trainings are offered by request or on an as-needed basis. CHP Quality Division has its own quality webpage to help keep our practices well informed. Upon entering the Community Forum homepage, you can access the quality page through selecting departments on the burgundy toolbar section across the top by clicking on the drop-down CHP Quality. You will be brought to this exact view. On the left-hand side, you will be able to access several quality and regulatory documents, including CHP Quality Corner monthly newsletter publications, MIPS provider reference guides for 2022 and 2023, HENA's 2023 measure descriptions, 2023 MIPS historical quality benchmarks, hand hygiene documents and guidelines, annual well visit quick reference guides from PNA, and training events for 2023. Additionally, you can find some credentialing information with CHP just below. Stay up to date with your quality regulatory division with our CHP Quality Corner newsletter. This is a monthly publication focusing on quality management and regulatory compliance topics. Our intention is to provide awareness and insight into a multitude of subject matters such as MIPS quality metrics across all provider specialties, patient experience, safety and risk compliances, EPIC hyperspace documentation capture, and announcements for future quality training and events for providers and practices. This publication is sent out by the second week of each month to your practice manager, as well as published on our CHP quality webpage for easy access at your leisure. This brings us to the very end of our webinar. I would just like to take this moment to thank you for your valuable time and attention. And we appreciate you guys participating in this training segment. You can find our contact information listed on this slide. You can reach out to us directly at CHP Quality Corner at communitymedical.org. You can also access our webpage or any information that was reviewed here today, and many of our highlighted communication processes with you at our webpage on the forum. Again, I just wanted to thank you for participating today. After this conclusion of this webinar, you will be prompted to take a post-test in order to claim your CME hours. The maximum hours is allotted for 1.5. So we ask that you exit this training and return back to the post page and complete it there, so that way you can claim those hours. Thank you so much, and thank you for your time and attention.